Marissa. I'm going to be your nurse. And just making sure you're here for a physical assessment, right?
Yes.
Okay. I perform hand hygiene, and can you please state your name and date of birth for me?
Christina Estrada, February 24th, 1998.
Perfect. And do you have any allergies, Christina?
No.
And do you have any allergy to latex?
No.
Are you currently on any medication?
No.
And are you currently in any pain?
No.
Okay. We also performed patient's vital signs. Blood pressure is 115/76. Temperature is 98.6. Heart rate is 70. Respiratory rate is 14. And she stated her pain was 0 out of 10. Okay. Can you tell me what day of the week it is?
Friday.
And can you tell me where you are?
In the doctor's office
Can you tell me why you're here?
for a physical assessment.
And what did you eat for breakfast? Cereal. Okay. Patient is alert and oriented ×4. I'm going to start by asking you some questions before we get started with the actual physical assessment portion. Is that okay?
Yes.
Okay, perfect. So can you please let me know when your last bowel movement was?
This morning.
Okay, and can you describe it to me, the consistency, the color?
It was brown and it was formed.
Okay, great. Did you experience any pain when you went?
No.
And how about when you urinate? Do you experience any pain?
No.
So what was the color of your urine?
Light yellow.
Okay, that's good. And was there any abnormal smell to it?
No, it was normal.
Okay, perfect. We also performed her eye test with the Snellen chart. She was able to read to line 20. So we determined her vision was 20/20. Okay, so next I'm going to go ahead and inspect your skin. Skin appears fair. There's no lesions or scarring or bruising. Okay, next I'm going to check your eyes, your ears. Okay. And how are you feeling this morning?
Fine. I feel pretty good.
How did you wake up? Were you in a good mood?
Yeah, I got a lot of sleep last night.
Okay, that's good. Do you generally get a lot of sleep and wake up in a good mood?
Yeah, normally.
Good. Okay, and I didn't see any cerumen in the patient's ear or any inflammation. The canal appeared to be pink. Can you open your mouth for me, please? Okay, and the mouth is pink and moist. Teeth are white. Can you stick your tongue out, please, and say ah? Okay, tonsils are grade 1. Thank you. Okay, next I'm going to check your eyes. So I'm going to check for pupillary reaction, okay? Can you look straight ahead for me? Thank you. Okay, so pupils are reacting to light. There is also a consensual response. And now I'm going to test cardinal field of gaze, which I'm going to move my pen light in 6 directions, or to 6 points, and I just need you to follow it with your eyes, okay? Okay, the eyes accommodated and followed my pen light, very good. So can you just kind of lay back at a 45-degree angle for me? I'm going to assess for jugular vein distension. So can you turn your head that way a little bit? I don't see any jugular vein distension. How about this way? No jugular vein distension. Okay, you can go back to where you were sitting before. Okay, we have 1 second. Okay, so next we're going to do a smell test. Can you tell me what you smell?
Coffee?
Great.
Cinnamon.
Perfect. Okay. Before I move forward, I'm going to palpate your lymph nodes, okay?
Okay.
Alright, so we're going to start at preauricular, postauricular, occipital, retropharyngeal, submaxillary, submental. Can you turn your head that way for me, please? Cervical chain, this way. Cervical chain on the other side, and supraclavicular. And I'm checking this by hooking the clavicle. Okay, I don't see any swelling. Thank you. Can you smile for me, please? Can you puff your cheeks out? Great. Can you stick your tongue out for me? Can you move your tongue to the right? Move your tongue to the left? Can you shrug your shoulders for me? Perfect. Alright, so next I'm going to need you to stand up. If you could stand over there, face the wall, I'm going to say a couple of words and you're just going to repeat them, okay?
Okay.
Right there. Thank you.
Dog. Cat.
Okay, great. So stay where you are. Bring your feet close together and your hands perfect. Okay, so now we're going to do the Romberg test, and I'm going to test you for about 15 to 20 seconds. Okay, great. So there was minimal swaying. If I can have you start on this wall, please. I'm just going to ask you to take a few steps to the other side of the road, please. Okay, so if you can just turn around. And so you're going to do something similar, but you're going to put one foot right in front of the other and walk in a straight line. Okay, balance and gait appear to be coordinated and normal. You can go ahead and have a seat. And if you could follow my movements, please. Great. And if you can take your heel against your ankle and move it in an upwards fashion along your shin. And if you could just do that with the other one. Great, thank you. Okay, I'm going to listen to your carotid artery. Okay, no bruit heard. Next I'm going to palpate it. Alright. I'm also checking to make sure that her radial and carotid are equal, which they are. Okay, can I see your hands, please? I'm going to check capillary refill. And capillary refill is less than 3. Okay, can you lift your arms up for me, please? And then bring them all the way up to the top of your head. And then bring them down forward, and then all the way back down. And can you grip my fingers, please? Very strong. Thank you very much. Okay, next we're going to check reflexes. So we're going to check the bicep reflex. The tricep reflex, just relax your arm for me. Okay. Patient is responding so far. Thank you. And let's see, we're going to also check the brachioradialis reflex. Thank you. And then the patellar reflex. Perfect, thank you. I'm going to perform hand hygiene then. Alright, next I'm going to check out your chest area. So respiratory expansion appears to be even and normal. Skin color is the same as the rest of the skin. Skin is warm. Skin turgor is good. And next I'm going to listen to your heart sounds. Okay, so I'm going to start at aortic, which is the second intercostal space on the right sternal border. S2 is louder than S1. Pulmonic, left intercostal space, left sternal border, second intercostal space. S2 is louder than S1. Herb's point, third intercostal space. S1 and S2 are equal. Mitral, fourth intercostal space. S1 and S2. S1 is louder than S2. The tricuspid, fifth intercostal space, mid-clavicular. S1 is louder than S2. Okay, next I'm going to check for your breath sounds, okay? Okay, next I'm going to check for laterally. Okay, breath sounds are so far equal and normal. You could turn around so I can do the back. So I'm making sure not to do it over the scapula. Can you turn just a little bit more to the, yeah, thank you. Next I'm going to check for respiratory expansion. Take a breath for me, please. Again. Deep breath. Great. Okay, so for respiratory, there's good respiratory expansion. Okay, you can sit normal. So the next portion, I'm going to have you lay down and we're going to check out your abdomen, okay?
Okay.
How are you feeling so far?
Fine.
Okay, so can you lift your shirt up for me, please? Okay, abdomen appears symmetrical. I don't see any masses, scars, or lesions, no pulsations, and I don't see any edema either. Okay, next I'm going to listen for your stomach sounds, okay? They're actually bowel sounds. Okay, so I'm going to start at the right lower quadrant. I'm going to listen for 15 seconds in each quadrant. I'm moving to the right upper quadrant, the left upper quadrant, left lower quadrant. Alright, next I'm going to percuss. Just let me know if you feel any pain or discomfort, okay? I'm actually going to do hand hygiene first. What? I heard about 12 gurgles in each quadrant. Alright, let me know if you feel any pain or discomfort, okay?
Okay.
Okay, then I heard tympany in all quadrants, and I'm going to palpate. Same thing. Let me know if you feel any pain or tenderness. Okay. How you feel?
Good.
Okay, patient didn't report any pain or tenderness. You can go ahead and lower your shirt. Next, I'm gonna check out your lower extremities, okay? Let me know if you feel any pain. Okay, I don't feel any swelling, I don't see any scarring, any bruising, any lesions. Gonna also check for edema. There doesn't appear to be any edema so far. Good. Okay, I'm gonna check the popliteal pulse. They're equal on both sides. Next, I'm gonna check the dorsalis pedis pulse, which are equal bilaterally. I'm gonna check for capillary refill. Okay, capillary refill is less than 3 seconds. Can you push on my hands like a gas pedal? Thank you. Can you push upwards? Great. So strength looks good. Can you bend your knee and bring it upward? And now bring your knee out. Great. Okay, now you can put it back. Same thing with the other leg. And go ahead and bring it out. Great job. And that pretty much concludes our physical assessment. How are you feeling?
Good.
Great. Okay, so we're done. Please feel free to let me know if you have any questions, okay?
Okay, thank you.
Thank you.